Okay, we should be live. I'm just going to make sure, and we'll give it a minute for a few people to join us as well. Okay, we're all set. All right, we've got a few people joining, so we can go ahead and get started. All right, well, good morning, everybody. Thank you for joining us today for our network welcome. I'm Jamie Chavez, President and CEO of the Westminster Chamber of Commerce. And every Wednesday, we bring to you a live broadcast featuring one of our newest chamber members to introduce them and give them a chance to talk about their business or organization. If you're new to the broadcast, thank you for being here. We appreciate it. Encourage you to like our Facebook page so that you will get notifications for when we go live in the future. And if you're on YouTube, you can hit subscribe, and you can also watch all of our previous broadcasts there. We also offer broadcasts on Mondays, which are dedicated to city updates. So we talk to city councilors, our mayor pro tem, our mayor, and other city leaders. And that is your backstage pass to what's going on in Westminster. So hopefully you can join us for those as well. And we reserve the last Friday of the month for county updates featuring Jefferson County Commissioner Tracy Kraft-Thupp. So stay tuned to be informed about broader county matters as well. So as you tune in this morning to this broadcast, we encourage you to participate with us, ask questions, post any comments, say hello. We'll get to your questions and comments during the interview. And now a very warm welcome to Chloe Wells from Community Medical Services, one of our newest members. And we just had your ribbon cutting just last week, I believe, right? Just the other day. So welcome, and thank you for being here with us. We have some people saying good morning. Good morning, Dave. Thanks for joining. Good morning, Parker. Thank you for being here. All right, Chloe, well, I will let you just jump in and tell us about Community Medical Services.
Wonderful. Thanks so much for the introduction, Jamie. So we are an outpatient opioid treatment provider, and our focus is to eliminate the consequences of substance use in our communities. And we do this by a combination of medication and counseling. Some people might be familiar with the medication methadone. We have some others as well, and these medications are really essential at helping folks to get a break from the cravings and withdrawals that keep them in active use. But the medicine isn't the only thing that we do. We also bring in counseling and some supportive services. And our counseling is really focused on helping people develop new coping strategies. A lot of people, when they've been in the cycle of use, that just becomes the pattern of behavior. And it takes some discomfort and also a very supportive therapeutic environment to be able to dig into that and figure out how it all got started. How do we change those coping behaviors to establish some others? Knowing that some of the folks that we treat are experiencing homelessness, but we serve a wide gamut of people. Parents who have children and jobs. We have leaders of influential companies in our communities, really anyone and everyone. And the fact of the matter is that more than likely, most people know someone who's struggling with opioid use. You just can't tell. And our goal is to be able to get in there and support folks before it gets to the point that they're losing their job, they're losing their housing, and their life circumstances significantly change. And we also do some community partnerships. That's a really big part of what we do and what I get to do. I'm our community impact manager, and I have the task of going and talking to folks like the chamber and our neighbors and social service providers to help them understand what we do, but also to support the work that everyone else is doing. I'm a firm believer that there's not one person who shouldn't know how all this works, because you never know when you'll be in a situation where having this information could help you save someone's life. We do trainings on how to administer Narcan for overdose response. It's going to be our new CPR, and just one of those pieces that's going to become normal and first aid kits. And that's a huge piece of combating the stigma that we see in our communities that keeps people from accessing care. Most people don't want to talk about the challenges that they're having. We want to feel like we're presenting a healthy, successful life, even though things are always messy. And it's never as simple as it seems. And having these conversations really helps to change that. We can become a little bit more comfortable talking about what's happening and talking about the resources, then more people will engage in that care. And it's super effective. We've seen across the company, we have clinics in 13 states, about 75 total. Westminster's our newest in Colorado, one of 5. So across that whole footprint, we've seen that after the first 30 days, there's a huge improvement for folks. There's an improvement in accessing housing services, employment services, their physical health improves. And then usually by the 1-year mark, all of that has changed about 75%. So 75% of people are engaged with housing. They are returning to work or engaged in work programs. Their depression rates have improved significantly, all because they're part of the supportive program that meets them where they are without boundaries. So really helping people to get into care without those barriers. And part of that is just being able to walk in that moment that you're ready. The clinic in our Westminster area really supports that with extended hours. We're open from 6:30 a.m. to 5:30 p.m. 6 days a week, which means in that moment of being ready to learn more or to dive right in, there's a wide range of options for folks to get into that care.
Awesome. Can you tell us a little bit about what sets community medical services apart from other addiction treatment providers in terms of your approach and care model?
I would say the low barrier focus is what sets us apart. Most providers don't have the flexibility of walk-in services. Oftentimes we'll see that there's very limited hours for people to come in and get care, or they have to have an appointment or get on a wait list. And we know that having to wait until tomorrow or 2 days from tomorrow can be the difference between seeing the next day and people not being able to see that day because they've lost their life to overdose.
Yeah, thank you. So during your ribbon cutting, you talked a lot about this, and so I'm hoping you can talk about it now again. Can you explain the role of the medication-assisted treatment in addressing opioid use and why that's an important part of your services?
Well, it's amazing science that goes into how all this works. The medicines that we use to treat opioid use disorder bind to the opioid receptor, just as the substance does. So it blocks the receptor from getting the response that would usually get from a substance in a very safe manner. So folks who are using methadone for their medicine, for example, they can consume the substance, but they're not going to get anything else from it. So it's preventing overdose, and it's also creating a bridge for those folks who are trying to change their behavior, but also need that safety net so that they can stay alive while we get there. Knowing that abstinence is not realistic for most folks when they're really in the throes of this disease. So it gives us a safety net to pull them in, help them engage with care, and then build that foundation again. There are some other medicines that work for folks who have been successful with abstinence. But if someone who's not abstinent takes one of those medicines, they become very, very ill. A lot of people feel like they're going to die. It's like a really bad flu. So at this point in time, with the way that things are in the fentanyl era, that methadone has been a much easier medication to get people started on because there's less of that fear of becoming really ill.
Right. Okay, thank you. So what does a typical visit look like for a patient at one of your facilities from intake to receiving treatment?
We want to streamline the process as much as possible, knowing it takes a lot of courage to come through those doors. For the first visit, our goal is to get people through the whole process within 90 minutes, but it also depends on the person. So usually folks will come in, they'll check in at our front desk, they'll answer some questions, they'll meet with a counselor, they'll meet with a nurse, and then they'll meet with a doctor. And when they're talking with the doctor, that's when they go over which medicines are available and try to establish that plan of what's going to be best for them and what their care goals are. And then in the cases where some folks have a lot more to say, when they get in that room with that counselor, it can take a little bit longer. But usually about 90 minutes from the time that they walk in the door, the time that they've gone through that process, receive their medication, and then have a plan for the next day. Moving forward from that point, if people are just coming in the clinic for their medicine, it's usually about 5 minutes. And that they have a medical appointment or counseling can take a little bit longer. But these days, with some changes in federal regulations, more folks are able to safely take medicine home earlier on, which means that more people are able to come in, do the things that they need to do, and then get out and go to work and take their kids to school instead of having to come into a clinic every single day in the early hours in order to try to achieve all of those things.
Great, thank you. We have a question from a viewer. Are you seeing most opioid ODs, that's kind of a difficult, opioid ODs, are as those dependent on the substance, or are you seeing it as added to other substances? He says he knows 2 people who passed due to OD, and we assume it was accidental fentanyl OD.
David, I'm sorry for your loss. Unfortunately, that's becoming more and more common, and this question is a really important one to ask to try to understand how this is happening, because there's a lot of fear out there. We're seeing that there's fentanyl in most substances people are getting off the street, so more than likely that's happening with folks who are not known to have that challenge with opioid use. But a lot of our folks are intentionally using fentanyl as well. Once they know that they've used it, they enjoyed the experience, then they go for it again because they enjoyed the high that they got from it. And then very quickly, usually within about a week of use, it becomes an addiction. So from there, fentanyl poisoning is really risky because it's not consistent from supply to supply. So in the cases of teenagers who think that they're getting Adderall from a friend at school that has fentanyl in it, it could be a very different amount than what someone is getting off of the street who's intentionally using fentanyl. But again, it can vary significantly, and that's why it's really important to be aware of these medicines, because that keeps people safer if they are still going to experiment or use, so that they're a lower risk of losing their life as a result.
Yeah, thank you. And so you mentioned it can be very different from patient to patient. So how do you tailor your programs to meet the unique needs of each individual that walks through the door?
I'd say that the therapeutic rapport is really essential there, because we have to start with no judgment. If people come in and sense that anyone's going to judge them for their behavior, their choices, you're not going to be honest about your history. And we have to have the honesty about use history to know what kind of medicine is going to be most appropriate for a person, but also what kind of dose is going to be appropriate. There's different levels of getting to a medicine dosage where there's that therapeutic return where folks don't have the cravings or withdrawals. And that varies significantly. Some folks use a high amount, and so they have to start with a higher dose in order to receive that benefit. And some folks maybe never got to that point, so they can start lower. But we have to maintain that rapport so that if things change, we're able to support them. If people are able to decrease their use, and then gradually their medicine could decrease as well, but sometimes it increases too.
Okay. And what barriers do you see to accessing addiction treatment? And how do you work with people to overcome those challenges?
There are a lot of barriers. A large one is stigma. A lot of people don't want to talk about it. There's a fear of having treatment centers in the community. There's a perception that bringing these centers into a neighborhood is going to be bringing crime with it as well, when we know that historically it actually reduces crime. We also know that transportation and access is a challenge. Our model is to open these clinics closer to where people live. If you live in Westminster, you probably don't want to go to downtown Denver to get your medicine that you need every other day or every single day. So opening clinics close to where people are with longer hours really helps with the access. But these conversations helps with that too, because I guarantee that there's someone out there who didn't even know that we existed, who's going to know that there's a lifeline for their loved one that they never would have imagined.
Right, exactly. And you talked a little bit about the stigma, and things like this definitely help with this, but how else are you working to reduce the stigma around addiction and promote awareness of the recovery process?
I am diligently engaging our local law enforcement and our city officials as well. We know that a lot of the folks out there have had engagement with law enforcement. And in order for them to have access to resources, our law enforcement officers need to be educated on what's out there and how it works. They're not free from the same myths that everyone else has heard. Usually the information that's out there has been widely accepted, and that's where those conversations come in. I've had the pleasure of training several police departments on our services, what they are and what they aren't, so that they all know how we can work together, because it really does come down to that community collaboration. Similarly, there are several county health department groups that come together so that everyone can be more aware of how these pieces work and how they can supplement one another as well.
Great. And can you share some of the support services that are available for families of those that are going through addiction recovery?
Yep. Through CMS, we are working on bringing some family support groups internally, but there are several options throughout the community, throughout Colorado. There are craft groups, which are family-specific support groups for those who maybe are not in a place where they can talk about their loved ones' use directly with them. It gives them the skills for having those conversations and developing healthy boundaries and getting to a place where that family can come together again in a way that maybe they haven't been able to for a long time.
Mm-hmm. Great. We've got another question from a viewer, from Parker. Do you all partner with the police departments to send people to you all when they find people facing addiction and want to help?
Absolutely. Our goal is to be that provider that folks can bring individuals to. Maybe they don't need to go to jail for whatever the call was. Maybe they just need to get to a treatment center. We want to be that treatment center to get them in right away to support them, because we know that this can change someone's life if they continue to catch cases when there was another option. We also would love to develop partnerships in which we follow up on overdose calls. We do this in Minnesota and Wisconsin, where we go with first responders and we go door to door, make phone calls to any residents in which there was an overdose or substance use call, so that we can provide that support and just check in with people. And that itself takes a lot of pressure off of our law enforcement and helps people access that care.
Looks like we had a little bit of a glitch there, but I think we're back. Thank you, Parker, for the question. Maybe you can talk a little bit about what impact you have seen in the communities that you serve, particularly here in Westminster or around Westminster area, since opening your facility.
We've seen almost a dozen people come in for services already, but we've also seen a lot of agencies start asking questions. We're working with our co-responders and the responding communities so that we can be a resource there. And we're actively offering naloxone kits. Just in the last year throughout Colorado, really through the Denver Metro, we've distributed 850 naloxone kits, which empowers so many people with saving a life. We've also done several trainings for the community, talking about how this works, and distributing essential supplies to our neighbors in need, to the tune of 175 over the last couple months. And we've really been opening the doors through access. We started with one clinic in Aurora back in October of 22. And since then, we've been able to open 5 more. And we're serving thousands of Coloradans to date, and helping people to stay alive, but also to achieve the life that they want.
Great, thank you. What are some of the upcoming goals or initiatives for community medical services in the next year, both locally and even nationally?
Well, we have 3 more clinics coming in Colorado, so I'm going to be kept very busy with that in the interim. We're opening in North Aurora, Lakewood, over by Casa Bonita, and then also in North Glen. Again, trying to catch those neighborhoods right where they are. And then we really want to deepen those relationships. Talking about the first responder partnerships. After we have these sites open, it's really a priority of mine that we can take the next step up to provide that follow-up and supportive care and find a way to be a safety net for our first responders. I know firsthand that a lot of them are experiencing high amounts of trauma from the calls that they're responding to, and they need more support than they're receiving. And if we can help with that, we want to. But we also want to advocate the higher level for funding for programs. And I would love to see more families engaging in conversations and education about this, knowing that it doesn't always have a direct return. It might not be tomorrow that someone's able to connect their loved one with a resource, but just knowing yourself gives you a little bit more context so that you can understand what's going on with that person when usually it feels so confusing and so far away.
Great, thank you. And where do you see the most potential for growth in addiction treatment services? And how are you preparing to meet that need or manage that growth?
That's a great question. Access to care is the greatest need. Most people, especially in rural communities, don't have access to care. Our rural communities are not immune from the fentanyl crisis. And we see that a lot of people are driving several hours to get to a clinic. And if you can imagine trying to make a drive of 2.5, 3 hours to get medicine and then to get back home, that's 6 hours of your day round trip gone just for medicine. And it's very hard to have a proactive and productive life if that's what your world looks like. So we want to see increased access through mobile units and rural clinics to help those communities to thrive as well.
Great. And how can the local community and the business network support the work that you're doing?
Well, reach out to me so that you can learn how to use naloxone. That's a huge piece. We know that you could be anywhere and have the opportunity to respond to an overdose. We want to empower you to do that, especially those folks who go to concerts. We know that that happens a lot at different concert venues. So you should know how to respond just in case, but also just having the conversation. If you want to know more, reach out. I'd always be happy to share more and figure out how I can help. And anything that you're seeing within your own neighborhoods, supporting our businesses, and trying to be that resource where if you have someone outside your business and you don't know how to support them and you don't know how to engage them, call us. And we would be happy to come over and help provide that support for you, your staff, and that individual as well.
Great, thank you. And then what advice would you give to someone who's considering seeking treatment but might be hesitant to take that first step?
You can always bring a friend. There's no reason to have to go it alone, and always ask questions. Even though it can be incredibly unnerving, it's best to go in and ask the questions and get a firm understanding of how it works. And that itself is going to help you to make the decision that's best for you. And that starts by opening the door or picking up the phone and starting with how does it work?
Great, thank you. Do you have any success stories that you may be able to share with us about someone whose life was transformed through the support that they received at Community Medical Services?
We do. If you go to our website, there's some specific videos of some of our clients in Colorado specifically who have shared their success stories. We have several folks who have gone through the carceral system where they did not see that there was a possibility of their life changing. They had been released and then not had success engaging in treatment and gone back to a facility. And everywhere they looked, they've been told that they couldn't achieve anything. And all they would ever be was someone who used drugs. And they came into a clinic. They didn't have any other options. And they found that coming into a place where you're welcome, people want to support you no matter if you feel like you're making a mistake, they're still there. That helped to build their self-esteem. And the medication helped them to feel really well in a way that they didn't feel could ever happen. And we've seen several folks go from that mindset of, I can't do more, this is all I can do, to choosing a career path and going to school, investing in themselves. We have several clients who have regained custody of their children, have been able to go places that they never thought they could. But we also see a combination of that where folks are coming in that early stage, and there's someone else in the lobby of the clinic who's been where they are, who's gone through those challenges, has come out on the other side, achieving their goals with the support network. And the bond that forms between those two people is the greatest success, because it takes seeing someone like you who helps you know that you can do it too. And then the rest is pretty beautiful to watch.
That's awesome. Thank you. For those who are not directly affected by addiction, why is it important to stay informed and engaged in the fight against the opioid crisis?
There's a lot of information out there in the news. There's a lot of feelings and fear around what we're seeing. And education will help you understand how to stay safe and know what's real or maybe what's not the most accurate for your community. If you have children in the public school system or are out in the community, you should know what's actually happening and the risks. Right? We do some training on fentanyl potency, knowing that there's a lot of concern about coming into contact with substances and what that looks like for you. So know that, and it helps with the anxiety that we all feel in this era, but also gives you that preparedness for engaging with whatever might come your way.
Great. Well, thank you so much. Do you have anything else that you would like for our viewers to know today about your program or your services?
If anyone is looking for services, they can call our Westminster Clinic. We offer transportation support. which can look like going and visiting folks who are maybe unhoused and getting them transportation from wherever they are to the clinic, but maybe folks who are nervous and unsure of how to get there. We can remove that barrier so it's easier to commit. We can help you get there, and any questions are always welcome. We just want to take away that fear and help people know that there is hope.
Great. And where is your location so people know exactly where you are?
We are at 7508 Sheridan Boulevard in Westminster.
All right. Well, thank you so much for joining me today and answering all those questions. It's tough work. And so just glad to have you in the network and know where to turn if somebody is facing any of these challenges. So thank you so much. Appreciate you being here with us today.
Thank you.
And thanks everybody for joining. And I hope everybody has a good rest of your week.